Hello, everyone, and welcome back to another episode of Acupuncture is My Life. Now, since we're on the topic of heart attacks, I've gone over quite a few messages from many women globally discussing symptoms they're presenting with, and that it's good that they do listen to Acupuncture is My Life podcast. Many of them are going to see heart specialists and definitely follow up with visits to acupuncturists, and I've recommended a few of my global colleagues as well. But in responding to some of the messages that were left on the Acupuncture is My Life app, and if you don't already have the app downloaded, it's free at the Apple Store for iPhone users and the Google Play Store for Android users. Reading some of the messages led me to want to follow up with the podcast discussing the difference between a stroke, heart attack, and cardiac arrest. Because I'm seeing that many individuals don't seem to know the difference between these three, although they may be familiar with having heard of these three. And they are very, very serious conditions that do require medical attention. But I'm feeling as if many of you do not know what tends to occur with each of these events to the body, which is fine. And this is why you listen to Acupuncture is My Life podcast. First and foremost, if you're seeing your physician on an annual basis or even semi-annual and you're undergoing regular wellness treatments with your acupuncturist, strong possibility these are concerns you wouldn't have to worry about. Which is why I say, undergoing regular wellness visits, it could be once a week, once a month, once per season. You take a lot of what would be considered a health burden off of your shoulders. But first, I want to start with heart attack and cardiac arrest. And many individuals tend to consider these different events the same, and it isn't. It's not. Because why? Because a heart attack usually happens when one of a person's main arteries becomes blocked, causing a person's heart to not get enough blood flowing through it. Okay? That's a heart attack. And this can happen due to plaque buildup in a person's arteries. And when this plaque tends to break open and form a blood clot, this blood clot can block the flow of blood. That's a heart attack. Now, cardiac arrest is when your heart completely stops or presents with a very, very dangerous rhythm to it. Now, a heart attack can cause cardiac arrest, but not always. Sepsis can cause cardiac arrest. Pulmonary embolism, trauma, some sort of infection, heart rhythm problems, let's say arrhythmia. But cardiac arrest is just when your heart just completely stops. Whereas with heart attack, there's something causing blockage in the main artery, which causes your heart to not get enough blood flow. That's a heart attack. So those are the two differences. So these are two totally different issues. So you have to be careful not to confuse them. Because cardiac arrest has a lot to do with, let's say, it's neurological in the sense where, layman's terms, it's an electrical problem. Whereas a heart attack can be seen as a plumbing problem. Now, one tends to be a bit more serious than the other, and that's cardiac arrest. It's much more serious because it can lead to death so fast, especially if there's no resuscitation whatsoever, or fast enough, soon enough rather. Whereas a heart attack can be mild. You can have a heart attack and not even know it. That's how mild a heart attack can be. But cardiac arrest, no, you'll know it. And if you're not resuscitated fast enough, it leads to death. And the way in which a heart specialist, a cardiologist may approach dealing with this, these two issues, events, are different. Because when you, and speaking of heart attacks, I express, like, you'll experience symptoms of tightness of the chest or chest pain. And it doesn't matter if you're partaking in some type of activity or you're just relaxing on your sofa or sitting in a chair. You'd still experience this tightness of the chest or some type of chest pain. But I expressed in a previous podcast, now women may have, let's say, shortness of breath and pain that radiates down their arm. There may be some numbness and tingling in their shoulder, radiating down to the hand. Now, when it comes to cardiac arrest, a person would just pass right out. Boom, just pass out. They'll feel dizzy or lightheaded. Then they'll just suddenly just black out. And CPR or some type of shock with a defibrillator to jumpstart their heart has to be administered right away, or it's over. And that's your difference between heart attack and cardiac arrest. Now these, once it gets to this level, it requires emergency care as well as a heart specialist. Now, acupuncture comes into play before in an attempt to avoid ever experiencing this, or after, when you're in the rehabilitative stage. So remember that, because in acupuncture, first and foremost, we understand that health is wealth. The wealth isn't in the bank. It's not in the safe. It's not in your pocket. It's not in the purse or your purse. It's not under your mattress. It's not in the shoebox in the closet. And it's not under the doghouse in the backyard. It's in you. And it's important that you understand that. Now, strokes, because I expressed heart attack, stroke, cardiac arrest. Stroke is more brain relative. It's more tied to the brain. There are two types of stroke. One is ischemic and the other one is hemorrhagic. Now, ischemic strokes are basically strokes where like blood clots will cut off the supply of blood to an area of the brain. And when that part of the brain doesn't get blood, it shuts down and it dies. That's an ischemic stroke. Now a hemorrhagic stroke, it's slightly different. This is an event that occurs when there's bleeding in the brain relative to, let's say, a ruptured blood vessel. And the brain becomes damaged as a result. So those are your differences between heart attack, stroke, and cardiac arrest. You see, symptoms of a stroke, there would be, let's say, a severe headache. There can be a sudden numbness or weakness, paralysis of your face, your arm, your legs. There'll be some confusion and difficulty speaking, and it'll become more difficult for you to understand what other people are saying. Issues with your balance, sudden vision changes. And the way doctors would treat that, I mean, it differs between ischemic and hemorrhagic. Ischemic, doctors would need to deal with the actual blood clot, whereas in hemorrhagic stroke, it's all about controlling the bleeding. And people who suffer from either types of stroke tend to have lingering symptoms for the rest of their life, but can take up to a year or two to heal. This is where acupuncture comes into play. Because more times than not, they're sent to see an acupuncturist also as part of their rehabilitation regimen. And acupuncture is great for treating stroke patients. You know, and although they're like different conditions, these are different conditions, let's say heart attack, cardiac arrest, and stroke. Here's what's surprising. Here's a surprising similarity. They share the same risk factor, that being high blood pressure, high cholesterol, smoking, obesity, diabetes. Think about that. Think about those conditions and how acupuncture treats each and every one of those, which is why I stated, like, acupuncture comes into play before with the intent for you to avoid ever experiencing a heart attack, cardiac arrest, or even a stroke. Because there are acupuncture points to help with you quitting smoking. Acupuncture is great for treating high blood pressure, high cholesterol, obesity, type 2 diabetes, and more. So you see how acupuncture fits into all of this? Again, it's part of you having to understand why I'm constantly saying, make acupuncture part of your life. Because acupuncture is my life. What's yours?